This is Dr. Sanders bringing you another tip of pain here. This is what you can do at home. If any of you out there are struggling or are experiencing foot or ankle pain, specifically kind of along the arch and behind the ankle, believe it or not, that pain may not be coming from the foot or ankle, but coming from other muscles further up the leg. Today I want to dive into the particular muscles involved in that kind of pain and instruct you what you can do to help with that pain. So first, let's talk about the symptom pattern people often notice. A lot of people feel this pain along the inside of the ankle, through the arch of the foot, into the heel, or sometimes along the bottom of the foot. Some people describe it as a deep ache, soreness, cramping, fatigue, or tenderness when walking. And one thing that's really common is that the pain tends to build the longer someone is on their feet, especially during long walks, running, standing for long periods of time, climbing stairs, or walking on uneven ground. Sometimes people even notice the foot feels tired or unstable, almost like the arch is struggling to support them. Now, the muscle we're talking about is called the Tibialis Posterior. This is a deep muscle located inside the lower leg, kind of behind the shin bone. And even though most people have never heard of it, it actually plays a huge role in how your foot functions. One of the biggest jobs is helping support and stabilize the arch of the foot while you walk. I often describe it like a dynamic support cable for the arch. Every time you take a step, your foot naturally flattens a little to absorb force. That's normal. But this muscle helps to control that motion so that the foot doesn't collapse and inward excessively. Then, as you push off to take the next step, the muscle helps stiffen and stabilize the foot again so your body can transfer force efficiently. So it's constantly working during walking and running. And that's where the problem can start. If the foot repeatedly rolls inward too much, what we call excessive pronation, this muscle can become overworked trying to control that motion. That overload can gradually irritate the muscle and tendon. Things that commonly increase stress on this area include excessive walking or running, worn out shoes, uneven terrain, poor foot support, standing for long periods of time, flat feet, instability in the foot and ankle, or sudden increase in activity in the area. And what's tricky is the pain often shows up in the foot even though the muscle itself is higher up in the leg. So someone may focus only on the heel or arch, while the deeper stabilizing system is part of the bigger picture. One really interesting thing about this muscle is how hard it works during walking. Your foot actually changes roles during every step. At first it acts like a shock absorber, then it transitions into a rigid lever so you can push off the ground. The tibialis posterior helps control that transition. So it's overloaded or irritated, walking, running, and standing can all start feeling progressively worse. Now let me show you one thing that may help to reduce stress on the area. Sit yourself down in a chair and bring your foot resting on the top of the opposite knee or leg. What you do is placing your hands starting closest to the knee and right behind the bone, pressing in on the soft tissue, you're going to first bring the toes in a pointing direction that point away from the shin, press into the spot on the muscle, and then slowly bring the toes and foot pointing towards the shin. Then you repeat that pattern all the way down the muscle. Now, I would encourage gentle pressure here to start because it may be sensitive, and you're trying to find the areas that are sensitive. So you don't need to be overly aggressive with the contact and pressure. I would spend about 3 to 5 times doing this a day if you're experiencing active symptoms, and only spend about 30 seconds to a minute each time. It doesn't need a lot of work. Now, if your symptoms are not reducing after 5 to 7 days or getting progressively worse as you start to do this, causing instability, making it difficult to walk, causing weakness during heel raises, or simply not improving over time, that's where professional evaluation may be helpful. Because foot and heel pain can come from several different structures, and understanding the mechanics behind the symptoms matter. So we here at Integrated Health Solutions specialize in discovering those instability, overcompensating patterns that could be stressing out this particular muscle. So if you're experiencing this symptom and the stretching work is not cutting it, go to www.ihsindy.com and schedule an appointment today with one of our proficient providers who will analyze your standing and foot patterns and hone in on exactly what is causing the pain and provide you with treatments and intervention at home exercises to help get you feeling better and keep you feeling better longer. Hopefully this helps explain why pain in the heel, arch, or inside of the ankle isn't always just about the bottom of the foot itself. Sometimes a deeper stabilizing muscle higher up in the leg is working overtime to try to control how the foot handles force. Your body is constantly adapting to the loads you place on it. And often understanding the why behind the pain is the first step toward improving it. So don't suffer any longer. Make the call. Get help. And thanks for watching. Check out other content on our YouTube channel or online to discover other tips that can help you feel better. Thanks again. Have a great day.